And hello, everyone. Welcome to our Monday night standard. It's the Fab Four. It's just that it's a little bit different four than the usual Fab. But make no mistake, it is Fab. And I also have to say that to Dr. Chansom right off the bat, pass my regards on to the Saints. Great job yesterday, beating up Tom Brady. Appreciate that. Packers have the home field advantage.
Beating up the Chiefs next week. That's pretty daft when somebody got beat 38-3. I'm just saying.
Yeah.
I wouldn't be talking like that, man.
I know. We're half the team that played then's on injured reserve now, so I guess that's changed. Let me run through our hello because I think Dr. Dart is really looking like LSU. I mean, if that's not LSU number pictures, I don't know what it is. So I'll introduce our guest last. There is the Dwight Sublett, who is decked out in the undefeated colors, which, by the way, what we've learned is even if you're Southeast Conference, you have one loss. We all know the media's in the bag for those people. Heaven's sakes.
There you go.
It's
you got
disgusting.
It.
So,
you got it.
Dr. David Chansom, Chief of Infectious Disease Prevention at Integris. Dr. John Armitage, who has been doing Bigfoot research for the past 2 weeks. I'm not sure. I think you've got yourself muted. I can't unmute you, Dr. Armitage. I want to hear all about the Bigfoot hunt. And then, of course, our guest, the executive director. He's the boss of the big cheese at the Tulsa Health Department. Everybody knows him as the man, also known as Dr. Bruce Dart. So, I mean, it does look like LSU colors, Dr. Dart.
Hey, it's just cold in the office, so wear a vest.
Well, we've got a good program for you, we think, tonight. We have a special appearance for, we started a Wednesday night stream last week, and we had some interviews with Congressman Lucas about vaccines. You're not going to want to miss that because I've got a couple that are just, we're going to play one tonight, and we're going to tell you what the interview is going to be. But Congressman Lucas has not minced words when it comes to what he thinks about folks who are not getting vaccines, and we'll talk about that. I believe Dr. Sublett mentioned to me earlier that the United States has hit a pretty good number, right? 70% now. Is that right, Dr. Dart?
Close. I think that's close.
That's correct.
David may, or you and John maybe have a better idea. That's about right. Yeah.
The mandates have all gone into effect. The numbers for 1st of November. The world hasn't ended. I'm just going to say that there's been, a little bit of a hiccup there, but my heavens, a lot of that stuff, like we're never coming back, the world's going to end, did not happen today, and so. How that works. But let's say hello to Dr. Dart. Dr. Dart, thanks for being with us. We had Dr. McGough last week, Oklahoma City County, and for Tulsans tonight. And we're on News 9, News on 6, the News 9 YouTube page, Twitter, Facebook. If LinkedIn ever gets their act together, we'll be on them. But that's okay. You guys keep on letting the other people take your numbers away from you. That's just the way it goes. But Dr. Dart, thanks. How are things going?
They're going well. I think as we all know, we've seen a decrease in numbers. We've seen a decrease in hospitalizations. Sadly, our deaths are still much higher than anybody would like to see them. But, I almost hate to talk about it because once we start saying that we're trending in a positive direction, things seem to change. But we're trending in a positive direction. And, COVID seems to have a 2-month cycle. Tomorrow we'll get our numbers. Hopefully it'll be our 7th week in a row of a decline in cases. And we'll see tomorrow. And we'll really find out how it's going.
Yeah, it'll be interesting. The cold front's coming in.
Yeah, I know.
Your 7-week drop.
Yeah.
You made a great point, Dr. Dart, that the numbers seem better, but the deaths are going up. Death is always a lagging indicator in this, right? Because, when I was looking earlier at my hospital stats, about 60% of my inpatients who have a COVID tag on them are out of their infectious window, which is 21 days. That means they've been in the hospital for at least 3 weeks. And those people are the ones. So today, I think the total was like 1,360 cases, I think, or something like that for the state. But there were 66 deaths. Deaths are going to continue to be high for the next several weeks, I think, because those people who have been in the hospital for 5 or 6 or 7 or 8 weeks, sadly, are many of them are ultimately going to succumb to the virus, and so that'll be the last number that we see go down, and certainly the most tragic number that we have to watch.
And that's absolutely right. And what we're seeing with the Delta variant is a greater acuity of illness. People are staying in the hospital longer. And I mean, we're still getting reports of deaths that occurred in June and July.
Right.
And there's always that delay in reporting. So hopefully we can start to see that number change. But right now, it's very concerning.
Hey, Dr. Dart, where are you at in terms of vaccination numbers in Tulsa County?
So we're inching up to 75% of our eligible population have at least one dose. We're over 65% of our eligible population fully vaccinated. So definitely getting closer to that 70% watermark. We'd like to be able to move faster and raise that number even higher. But we continue to give vaccine out. All of our partners continue to vaccinate all their patients. So slowly but surely we're getting there.
I had a question about, I've been gone for a couple of weeks chasing Sasquatch, but coming back, a lot fewer masks in Oklahoma City than when I left. People are obviously getting the news that we may have topped out Delta and are getting better numbers, at least, with the deaths accepted, as Dr. Chansom mentioned, as a lagging indicator. But can you paint a picture of what you think, success in a couple of months will look like to us? Will we be tracking booster rates and not immunization rates? Will we, what does a good future look like over the next couple of months? What is the target?
And, Dr. Arms, that's a really good question, because we know with Delta, it's a constantly evolving game, and so I truly think that we're not out of the surge woods yet. I think we're going to have some more surge over the winter, especially. I think, like Chas mentioned, cold weather's coming, but I don't think we're going to see surges go as high as we've seen in the past. And I think that because we do have a combination of vaccinated individuals and people who have natural immunity. Now we know that natural immunity wanes faster than vaccination. We know that natural immunity isn't near as effective as vaccinated immunity, which is going to contribute to the possibility of surges in the future. Because we do have at least at the higher level of the combination of natural acquired immunity and vaccinated immunity, that we'll still see some surges, but I seriously doubt they'll spike up to where they were. But I think people need to understand that this is endemic now. It's here and it's here to stay. It's not seasonal, so it's year round. So we have to really start looking at what the recommendation is going to be about boosters in the future, whether it be an annual vaccine, a biannual vaccine, and then making sure that vaccine matches whatever variants can be circulating, because we're already following Delta Plus, which we found in at least 5 places in the country. We know Delta Plus is even more infectious than Delta. So these things, the virus keeps changing, and it keeps adapting to all the things we throw at it. And so people have to be vigilant and have to continue not to put themselves in a situation where they're exposed or possibly infected.
I've got a quick question. Of course, tomorrow and the next day, the advisory committee is going to be meeting on the 5 to 11 age group. Do you all have any contingency plans made? I know they're shipping out about 15 million dosages around the country. Have you heard any news there from your standpoint as far as the health department? So we've ordered about 4,000 doses of pediatric. We're waiting for the meetings to go Tuesday and Wednesday. Mm-hmm. And we assume it's going to be approved by ACIP and CDC, and then after that, all we need is the guidance from the CDC to start shooting. So best case scenario, we can actually start vaccinating those pediatric patients late this at the end of this week. Worst case scenario, early next week. So it's going to be available. So we have our order in. Hopefully it arrives, because it's interesting when we talk to parents about vaccinating their children. It's a little different conversation we're having than just having a conversation with individuals about being vaccinated. And even parents who have gotten vaccinated are a little hesitant about getting their children vaccinated. Right. That's why we're asking them all to call all of you, people like you, the pediatrician, the primary care provider, to really have that conversation about what's best for their children, because we know that it's very effective so far. The science has been pretty clear that adverse reactions aren't any different than what we see in adults. So it's positive news, but having the conversation, and it's so emotionally tinged, I think
parents are having to decide whether to vaccinate their children or not. And I know all of you are able to talk to parents. We are, and because we want parents to have that conversation and go to their provider and ask the question that they need to ask.
Yeah, agree.
No, I agree. I mean, I think it's going to be interesting to see what the uptake is. As you've gone down the age categories, you see less and less and less uptake. Like you said, we're at, let's see, I pulled it up here right now. Persons greater than 18 years of age, fully vaccinated, 69.6% in the United States, at least one dose, 80%. And then when you look at when you drop all the population over the age of 12, 67.9% fully vaccinated, 78.1 at least one dose. In the total population, 58%. So, but what we've seen is, greater than age 65, that's our best vaccinated cohort, right?
Mm-hmm.
Then you go down to 50 to 64. Then you probably go down to usually like 40 to 49, and then 18 to 39 kind of falls into one big category. And then you go down to 12 to 17. So, and as we go down each of those, you see probably, I'm going to guess, a 5 to 10% drop, particularly when you go from 40 to 49 to 18 to 39. You see that cohort. The 12 to 17s probably look pretty close. But, when they've done surveys, it's about 30% of parents say they'll go get their 5 to 11-year-olds vaccinated.
Yeah.
And the argument is, well, they'll be fine. And, Larry said last week there have been 700 pediatric deaths in the United States, which is a big number. But I would say there have been a ton more orphans. And the scary thing is, we have to remember, even though the little guys will be okay, little guys and girls will be okay, that they can pass the virus on to people who are more eligible, more vulnerable. I actually was talking to a lady last night at a Halloween get together, and she was talking about her kid being immunocompromised and how much that scares her still. Even if they take the masks off at the school, her kids are going to still wear them. That kind of stuff. That's the real concern. So I'd encourage people to have that same population health thing in their head about, I don't want my kid to get it. Nobody wants their kid to get it. Nobody wants their dad to get it. Nobody wants their spouse to get it. But also think about, your child as a member of society and being potentially a vector, for disease to somebody who may not be able to mount the same immune response that other kids can. So there's lots of things to think about when you're talking about getting vaccinated.
It's a good chunk of folks. The 5 to 11, it's like 28 million nationwide. I think we've got about 200,000 kids in that age group. I believe that's right. But if we can be fairly successful over time, I agree. I think it's going to start out that probably about 1 in 4 are ready to go. They want to do it. But I got a feeling that if it goes well, which I anticipate it will, that we'll see that come on up in the 50-60% range. I hope that's my hope. Maybe that's too optimistic. I don't know, but there's going to be probably 25% say no, all the way down the line. So, but I agree.
Dr. Dart, are you aware of any marketing campaigns that are going to be focused towards the parents? Role models, 9 out of 10 physicians' kids have received the vaccine, the kind of way to, it's a different message, obviously. Clearly the message to somebody over age 60 has a lot of the self-interest, and, this is a different story that has to be, conveyed. So I don't know, do you have anything that you've seen that really identifies that marketing segment?
So I've seen some information from some of our national organizations like NACHO, National Association of County and State Health Officials, and APHA. We've actually been looking at it because those organizations are a great source of national data, and they have a lot of survey data what parents are thinking. So we've been looking at that information, trying to really frame our messaging around what the national data has been telling us, and that data is also specific to parts of Oklahoma. So we know that, and you're absolutely right, the messaging will not be the same as it was to adults. It's a different message, and we have to be cognizant of that. And we've got really great we're very fortunate. Our department, we got great marketing people. I know that Oklahoma City County does as well. They work very closely with the state. So we're all having these conversations about what is the best message to use for this specific topic how can we message to parents so that, you know, we don't scare them, but we tell them the truth and give them information that's factual. So hopefully that it's just a matter of looking at the facts and taking the hyperbole out of the conversation. And that's what we're trying to develop here. So that it's just straight on. And, you know, hopefully we've generated a lot of trust in our community through this pandemic response, that they at least trust us to tell them the truth. And that's what we're going to do. And sometimes, you know, a lot of people might not want to hear that, but the truth is the truth, and is what it is. And we know at this juncture, the data is very clear that the best tool to prevent infection is vaccine. And as hard as that is, with the circumstances that we're living in today, it's a conversation we all need to have.
The more people that drive it home, the better. I mean, that's the only way to do it. I mean, you know, it's something that we've been saying it, but more and more and more, and, you know, hopefully what'll happen is, you know, as some of those first kids get lined up, and we saw the same thing with adults. We saw the same thing with teenagers. It's like, well, I saw Dr. Sublett got the vaccine and he didn't keel over, so I guess I'll go get the vaccine. And, you know, that kind of, you know, you kind of one begets the next, and hopefully you'll kind of see that. I think the uptake will be a little bit slower, but yeah, we got it, and it requires everybody keep messaging. These are safe.
Exactly.
You know, for the vast majority of people that don't have any problems with it, knock on wood, these are very, very safe vaccines, and they certainly are significantly safer than getting COVID. No matter what.
And I'm not sure that this is based on anything other than an impression, but it seems like a lot of the parents do a lot more group thinking than, you know, some of your more I would guess stick in the mud older folks, you know, opinionated older folks. I think when it comes to kids, parents are always looking for other signals, because it's such a journey as a parent. You're always learning new things, and your kids are always going through new developmental stages. So maybe there's a more of a group think and role modeling that could help there. I don't know, but it seems like we have the chance to put in front of the public some thought leaders, you know, from the, you know, parents who want to make the testimonial about why they made the decision. And, you know, I think that stands to be more effective in that audience than in many. So
I think,
and I'm sorry, we just really recognize that these parents are very much engaged in digital platforms and social media, and that's really where we're putting a lot of information, because you're right, Dr. Armitage, it really is a group talk, and it's group talk on these platforms. So we want to make sure that we've got the right information, and I think that the correct tone on the platforms that everybody's using to discuss and make decisions, and hopefully come to positive conclusions. And our goal is just to make sure that they have the information in front of them so that they can come to the right conclusion for their families.
I think it's, you know, emphasizing that the protection, not only for the patient, but the contacts, and probably even more important, we've been dealing with the mental health issues with kids, as far as the, you know, with the upset as far as going to school and disruption of everything. And we're, you know, this is a big step forward to try to keep the school year as normal as possible, resume some normality there. So I think that's another area we can emphasize in the process.
I had a question, maybe either for you, Dr. Dart, or Dr. Chansom, about as we move into the endemic, you know, chronic phase after almost 2 years here. Are we going to start dissecting out the kind of an A and a B version, the A being a natural infection and somebody who's never been exposed, and then the kind of B type natural history or symptomatology or even statistics around hospitalizations and death rates? And it seems like there's almost two different populations here, and our experience and our data reflects kind of the naive experience with the virus. And obviously the first pass is going to be the most devastating, as people who've never seen it before, either through a natural infection or through a vaccination, you know, they're going to be the most susceptible, I presume. And then you get into this sort of vaccinated who then get infected, or naturally infected who then get a second infection. Do you see us moving into kind of like an A and a B version of the statistics and the kind of the natural history description of this, or are we just going to continue to sort of see them put together as a one?
I think you're already starting to see it. They released a big article today. I've got it somewhere in my mess of an office on the MMWR about the risk of reinfection. So they had kind of a small study in Kentucky that showed the risk of reinfection of natural versus vaccinated. I'm sorry, all people who had COVID, people who were not vaccinated versus those who were vaccinated, but they'd already had COVID, and their risk of getting it again was about 2.5 times higher in that natural infection or that natural immunity only versus natural immunity plus full vaccination. And then they had another one today that was even a bigger database, I think, that showed an odds ratio of about 5.4. So, I mean, I think you're starting to see, because that has been a real hole here, is what do we do with natural immunity? Well, I don't need the vaccine because I already got it. I already had COVID. And you know what? We talk about scientists not being intellectually honest and us saying, you got to get the vaccine. Well, why? And we have to answer that. If they're going to trust, Armitage, if you're ever going to trust Fauci again, they have to be honest about this, right? So we have to look at that. And that data is starting to come out now, but that takes a long time. We had to wait because you got to wait for the first wave for people to get infected and the second wave to see if they get it again, right? So that data, I think, will continue to be, and then the holy grail, of course, of testing a natural infection is what's a protective antibody level. That took years to find for other diseases like hepatitis B or rubella, or all these other things. It took years and years and years of population-based data. So then you were able to kind of classify different people based on that. And I think until then, we have to continue to ask those questions, to be intellectually honest about it, but also to come back constantly to how safe the vaccine is, even for people who have been previously infected, and that you can get more protection from it. So.
Yeah, and I just think the data, I saw a couple of the reports with the natural infection not conveying as long an immunity, and I just think the public's now going to have to start sorting it out for themselves too. The doctors, people who are reading the journals, they're more advanced in sort of subpopulations and the different variations of, combinations of booster and vaccine and natural infection. But I think that public, if they're going to get the maximum benefit from this new data, we're going to have to start sort of coaching them to divide the world into, the subsets. And it's not some weird study that appeared 1 week. This is a new trend. It's a new level of understanding and data collection that really does help us migrate into long-term knowledge, as opposed to kind of crisis management and some very bleak statistics with the first pass through the herd, obviously. So now how do we set the table so people can realize, well, this is now a different game, sort of. You have to pay attention to different things, presumably. And like you said, antibody levels, we haven't done much coaching around that because we haven't been confident, but
we don't know.
Yeah. But that's going to be potentially something to alert the public to start looking up for that. And boosters are going to be totally tied to that concept.
Right.
And frankly, I think the more antibody testing that we actually do will be really helpful because we've got to figure out really how long is natural protection conferred after infection. We truly don't know, and all the data now we're seeing is that not near as long as those who were vaccinated, and we're starting to see people who were infected early in COVID in Tulsa. We've had a couple of reinfections as well, and so do we want to avoid this? Do we want to get vaccinated? And so how we message this and how we talk about this, I think is really important because people are extremely confused, and with the politics and the environment that we're in, I think they're incredibly sick and tired of hearing about COVID. Yeah. But going forward, it is what it is, and we've got to have honest conversation and not push it down people's throat, but I think be very specific and distinct in our messaging, so that even those who are COVID weary can hear it and listen to it.
Hey, Dr. Dart, I have a real quick question that about other things that are happening in Tulsa area, but I saw this weekend that there was a fair kind of a B-level actress who's been an anti-vaxxer is having to go to the hospital, and they started talking about the social media and these memes that go around. And of course, there's the Herman Cain meme, which a lot of them have changed from the karma meme. And so I think way back to when a lot of the battles you've been fighting, we think all the way back to where Herman Cain probably picked up the coronavirus as a big rally in Tulsa, and you guys were talking about you got to be safe, you got to be safe. We still see the same sort of disregard for that around the country. But I was going to ask you one or two questions. The first is looking at how that you've dealt with this and the pressure you've been under. You mentioned it, the P word, politics. Over the last 18 months, in the experience that you have and your people, which are we're working these 20-hour, probably still are, 7 days a week. What sort of lessons would you pass along to federal folks, CDC, FDA, folks on the ground, the lessons that you've learned over the past year and a half? When the next pandemic comes, what have we learned, and what do you think that they're still not listening on the federal level?
They changed the messaging so much, and it's led people being so confused, and it's led them to not trust us as government officials and as people who carry this message. So, I know that the virus, we understand it's highly evolving. It evolves very quickly. It changes very rapidly. And our goal was to notify people when the data showed these changes, and science showed these changes. But when you're changing your recommendations so quickly, you have one recommendation 1 week, another recommendation for the week's over, another one for the weekend's over. I can understand why people get confused and get lost and just get sick and tired of hearing about it. So, heaven forbid, we had H1N1 10 years ago. We were very fortunate how that turned out. Right. But we had worst case scenario with COVID, and hopefully we learned a little bit about communication. And I think Dr. Chansom was really hit the nail on the head. Just because we're scientists, that doesn't mean we always get it right. And we have to be able to say when we're not, and we have to be honest about that. And I think there was some there's some fear of being wrong and having the wrong message, as opposed to let's wait and really see where the science evolves before we craft our message. And that sometimes the message came out almost ahead of the science, and that just didn't help us on the local level at all.
What struck me when you say that is the cadence that politicians want with information and that the media want are different than the cadence of science. Mm-hmm. And the scientists did not hold their ground and say that, we aren't on a 24-hour news cycle, and, answers will have to wait for good mm-hmm. studies, and then distinguish that kind of firm scientific approach to here's an opinion. You're desperate to do something. Here's an informed opinion, but it's not science. And I don't think we made any differentiation between somebody who was an expert having a suggestion or a recommendation. That they look like a scientist, and I'm probably guilty of blaming Fauci. He was trying hard to use his best judgment. Thank you for that. But at the end of the day, he didn't make the distinction. And it's up to the scientists to sort of take off the one hat and say, now I'm getting into educated guessing, and I'm not really giving you science here. And the idea that we talked about the science is an indication that we muddled the whole thing up. Mm-hmm. Right. So maybe that's a lesson for the scientists and for the medical community to stand behind their own cadence of, when are you relatively confident in something, and when are you just taking a really good guess, making a recommendation with all good intentions, but it could be subject to change. And maybe you put that little warning label on it, and maybe people feel less upset when it gets changed later on, because at least you can go back and said, I told you it was a guess, a best guess. It wasn't quote unquote the science.
There was a lot of traction in the press this weekend about the CDC kind of admitting that they probably did not message very well. And my daughter's a strategic communications major at an out-of-state university that wears purple that may or may not have fired the football coach yesterday. And I told her, I was like, you ought to do your senior thesis on the messaging during COVID. And that's what she's doing it on. I said, you can think about it globally. You can think, I just think about what we did at Integris, and I know what Bruce has done in Tulsa County, how you message it locally, and then you can really get into the weeds on even the microscopic. There was a great article from a region in India that talked about how they communicated got up to 100% vaccination rate by communicating it to local elders and leaders. I mean, different communication strategies have to work. The problem is John, you hit the nail on the head. We want information now.
Yeah.
We want
It's
it.
a
We want it
knee-jerk.
every 20 minutes.
Mhm.
Yeah.
That study isn't done yet. You guys just started it an hour ago. How can it not be over? That's not the way science works. And frankly, if it does work that fast, it's bad science, And I'll take as an example the ivermectin study that was the meta-analysis.
Mhm.
This guy in Egypt throws together a bunch of data and they throw out a meta-analysis. Well, they came out with the redone meta-analysis after they took out the fraudulent studies. That first ivermectin study that everybody wants to throw around, 51% survival improvement. They took it out. They redid the meta-analysis without the fraudulent data, and suddenly it's 4%, which was totally non-statistically significant. It was, it doesn't work. Just to be clear, ivermectin doesn't work. But that was kind of that rush to science sometimes. Now, it's a balancing act because we had to get some information out there. When JAMA went to the open network where they were just throwing studies up there, well, that's how hydroxychloroquine and azithromycin got started. Because we had a few studies out of France by a very well-respected infectious diseases doctor who's going to be in the Hall of Fame. But you know what? It wasn't clean science. It wasn't timely science. We needed something, and you have to kind of balance that. And that's where we need way better messengers in the scientific community. I got news for you. They ain't going to be scientists. You know what I mean? They're going to be people who are professional messengers. And I think you're going to start seeing more of that come out of the CDC. If they haven't gotten the message that they need to do that, well, then that's on them. I mean, that they clearly need that. They clearly need somebody who can do that, who's not a spin doctor, from an administration or something like that, who can just say, I'm here to talk science and try and translate what you geeks are saying to the masses over here. So,
yeah.
And that was one of our main messages to the CDC is, will you guys please stop talking until you actually have your science down?
That's right.
Because, whenever they get pushback, they change their message, which told me that they weren't sold on the science. So you're absolutely right. If they need to slow down, they need to also say, hey, this is what the data was telling us now, but things have changed. But wait a little bit, because they're constantly correcting themselves. And when you lose your credibility, especially in throes of a pandemic, it's really hard to get it back.
At this stage in the pandemic, it's sad that we aren't to the nuanced communication level. There's somebody online here talking about, that the old white guys aren't the way they want to get their information. Well, okay, we need to figure out the voices, but that's a process, right? You've got to find the spokespeople, the credible folks who have the time and the desire to speak the right language to many, many subsets of people. I mean, we're 2 years into this. We should be having a scalpel approach, and we're still at the bludgeon. And we're that's shame on a lot of accountable folks, all across the spectrum. And it's some people are stepping up to the microphone, and maybe we need a wider group of volunteers. We need more people who are willing to raise their hand and articulate important things where the messaging isn't lost because of the messengers. Okay, great. Let's work on that, CDC. Let's work on that, everybody. Let's work on that, scientists and medical folks who really know how to communicate those things in diverse ways. But again, people are getting confused and lost, and they're letting biases infect the conversation, and we need to realize that, and we need to inoculate against that. And we should be there at this point, but I can't say that I've seen a lot of work done on any level
I agree.
to try to nuance the delivery. I think we feel good in crisis mode to cover 80%. Well, 2 years in, we should be at 98% coverage of the delivery mechanisms. But But that's going to require more than the 5 folks on this call. I guarantee you, it's going to require a lot of people who want to step up and volunteer and jump into the space, and help.
Well, no, I
I've
think
got a-
you're right.
I've got a quick follow-up for Dr. Dart here. And by the way, the person that you were referencing, Dr. John Armitage, that Augusta be back Wednesday night. So we started a new platform on Wednesday night, and Augusta McDonald is one of our regulars, and so she'll be back. But that's Wednesday. This is a Health Watch, so that's News Watch Oklahoma. And I mean branding. By the way, I would ask you, Dr. Dart, the following question. I'm talking about mea culpas. 6 months ago, we changed. This was COVID Watch, COVID-19 Watch Oklahoma. Remember that, doctors? So as we were watching COVID wane, we began to discuss there are other things we need to be talking about. The docs had said this for some time. We want to get into mental health issues. We want to get into the issues where people that have not been doing these things, not seeing their specialists, not getting their checkups, not checking their weight. I mean, all of these things that were still out there. We changed the name. It became Health Watch Oklahoma because COVID was doing this, and then what history was, right? So I'm sure there's that sort of tongue in cheek on this one, Dr. Dart. I'm sure there's no issues at all waiting for you. Once COVID wanes in Tulsa County, there's no challenges left for the Tulsa Health Department. Now, that's I'm being sarcastic. What are you facing up there outside of COVID? What sort of challenges do you see that have been neglected for a year and a half that are really concerning you?
Everything has been neglected. I mean, we've had to redeploy almost our entire department to the response. Now, we were able to maintain clinic operations, but not to the same scale before. And now we've lost so many nurses and clinic staff that even as the pandemic wanes, we can't stand up our clinic operations to the level that we were able to before COVID, because we can't replace staff who've left. We still had, so we were on a trajectory where we were improving our health status, and we were climbing up the county health rankings, and I was really proud of our county and things that we were doing. And COVID I'm sure has set us back. And some of the things that you mentioned, people were so involved and so intertwined with COVID that I think their own personal health just went down the tubes. And so, we were trying to do our strategic plan before COVID. We had to stop. We had to pick that back up again. It's time to do our community health needs assessment, because we had to figure out what needs to be done going forward. And once we finish that community health needs assessment, which we're just starting to do, then we have to create a community health improvement plan, because we have a lot of work. I know it's going to look totally different than it did last time we did it, because things have really changed, and we were improving last time. Well, I'm sure we've taken some steps back with COVID, and we've got people who we have to get reoriented back into thinking about their health and reaching their greatest potential that just went out the window with COVID and all that's occurred in these past almost 2 years. So it's almost like we're starting over in some ways. But my staff are so tired and so exhausted to think about getting back to the work that needs to be done. I mean, I want them to take a mental health break as well and just rest and get rejuvenated, because I think our staff do very important work. But when you're so tired and you're consumed with what's gone on the past 2 years, you can't frame and focus on what needs to be done. So I want my staff to know that they can take a step back and achieve some balance in their lives. And then we've got to start doing the work that really we're tasked to do. And, our vision is that everyone in Tulsa County reaches their fullest health potential. And, if we have staff who are re-energized and remotivated, and fired up to do that work, I know we'll reach our goal of being the healthiest county. But God bless them, they need a break, and that's just all there is to it.
Absolutely.
Yeah.
One of the interesting things, the blood center just finished as of yesterday doing hemoglobin A1Cs for the last 3 months. We don't have the data all put together, but we know roughly we're going to end up with about 30% of the population with an elevated marker, and then about 10% in the diabetic range. So we're keeping up with national stats, it looks like, maybe a little bit different on some of the subsets. But to me, and then we're also doing the antibody screening for folks who've had the natural infection, in this case, through the antibodies. And the interest in the antibodies is still so high, and the interest in the hemoglobin A1C is modest. And if you think of the health consequences and the burden on society of diabetes, It's every bit. It won't
Mhm.
send you to the the ICU as quickly as COVID can. But in terms of health impact, these are twin monsters, but one of them gets no play. It's old and boring, and it's a real shame that the focus that COVID has forced upon health concerns and precautions and dialogue, that we don't seem to be able to port much of that energy over to something old and boring, but very lethal and very damaging to individuals and families with by creating disabilities. And
Mhm.
it's a train wreck too, but we just want to walk by that one and go stare at the COVID train wreck. So some way to get beyond that.
This is what happens in public health. There'll be some money that comes into public health for a while, and then when it, just like there was after H1N1, you remember that chart? You remember how much money was coming into public health, and people were interested, and then they take their eye off the ball a little bit. Well, because we've had to divert all of those resources to the greatly unsung task of data collection, contact tracing, these absolutely important shoe leather type public health things. We have lost a lot of other things, that like taking care of diabetes, echoing how important it is to eat right. I saw a very good study the other day that showed how much alcohol related liver disease has gone up in the last 2 years. Really, because we're not messaging, take care of yourself, don't drink too much. All of those public health doctors, there's X amount of resources, and 99.5% of it has gone to COVID the last 2 years. We're going to have to recalibrate, but like Dr. Turk said, people are tired and they need a break, and we have to remember that too. But it's going to take some time. It's going to take some time to regather the resources to be able to make dents in those other things.
Even the concept of conceiving of a secondary COVID pathology, right? So alcoholism and liver disease, I feel bad. You see these people masking up and they're getting their boosters, and because of the stress of the family situation or maybe some of their losses, emotionally, they're probably removing almost all that positive stuff they're doing with their mask and their booster, and they're going and drinking themselves into an early grave because we haven't identified those satellite pathologies that are all clustered around the terrible disruption that's going on right now. And we probably need to start even defining kind of secondary pathologies that cluster. And start addressing them, because it's sad if you're going to spend all your time masking up and doing all the right thing, and then you go home and you hit the bottle, and because it's stressful, and the coping mechanisms, the socialization of going to work and talking to friends, that's all been pulled down. So it's not a blame game. It's a how do you recognize that what was bad before can be even worse now as a ricochet out of this COVID tragedy. And I think we see isolated reports of that. We see suicide rates being monitored, and we see, as you mentioned, alcoholism, substance abuse, but we haven't really clustered that together as the yes, wear your mask and please protect against these commonly associated ricochet pathologies. And it's a whole set of them. But I'm not sure that we're really articulating that. Watch out for these ricochet consequences, and be on the lookout in loved ones. Are you seeing the behaviors and recognizing it as maybe a reactive response to the COVID tragedy over the last 8 months?
I think you've coined a term here: satellite pathologies. I really like that.
That's a good one.
That's a good term.
Well, I know we need to let Dr. Dark go. He stayed around for us tonight, and I'm really appreciative of everything you do, and thanks for the time. We've got a bite we're going to play from Congressman Lucas if you want to watch in on this one, but we appreciate every time that you can come on and letting us know specifically what happens in up Northeast and our sister city. It's been wild, and Bruce Dart's one of the best. Thanks for everything you do.
Thank you.
Thank you.
Thank you very much.
Good night, Dr. Dart.
Bye-bye.
And thank your team.
I will. Thank you.
So Dr. Bruce Dart, the Executive Director of Tulsa Health Department. So let me get to this because we are going to be done at 7:59. By the way, it's 7-0 Chiefs. For those of you who've been following the feed over Dr. Chansong's shoulder tonight.
It's the Peyton and Eli thing. I haven't seen the Peyton and Eli thing yet. I don't know.
You will. You will.
I
really,
can't. I'm just
awful.
looking for all the comments that ask him to move the screen closer. And, could you make it more central next
Turn up the sound
time?
a little bit more.
We'll
There
be
you go.
sympathetic for the Chiefs tonight because they've got a really rough next Sunday coming.
I'm
But
not
anyway.
sympathetic for the Chiefs at all, ever.
Okay, so before we lose Dr. Chan something, we get out of here at 7:59. I had an interview. I think it was the day after we had Health Watch Oklahoma last week with Congressman Lucas. Our audience may remember that he was really strong a few months ago. And we've been working for a very long time to get him. And we're going to put up an entire interview with him shortly, the next couple of days. But I got some pieces for our new Wednesday night program. So people who saw the Wednesday night program, which doesn't have nearly the audience this one does, but nonetheless, he had just a little bit. I wanted the doctors and our audience on Monday night to hear. This is Congressman Frank Lucas talking about vaccines, and he's working a very narrow thread here, talking about the sort of things that Oklahomans believe, not mandate people, but yet his passion for what needs to be done, what's right, especially ends. It's like it's a great, funny way to end the program. Here's about 5 minutes of this interview. You're going to love this.
First off, I think, Scott, it's worth noting, and let's just discuss this up front. I'm not in favor of mandatory vaccines. I don't believe the government should have the authority to force anyone to be vaccinated. Vaccines are one of those things, whether it's COVID-19 or everything from polio to rubella, measles, mumps, even the shot that your doctor or nurse gives you when you have to have stitches to make sure you don't have tetanus. Remember old lockjaw, the phrase they used in the old days? Vaccines are a critically important part of our life. So I'm not mandatory. I think we should all think it through, rationally make the right decision. In my point of view, the right decision is being vaccinated. Whatever it is, why have the disease when you can take a vaccine and not get sick? Now, some will say the vaccines are not perfect. Well, no vaccine's perfect. I haven't found anything yet in the world that is perfect, but they provide an amazing level of protection. Now, that said, where are we at? When President Trump was in office and the COVID-19 scourge came at us, I suspect from the other side of the Pacific, but ultimately that will be figured out. When it came at us, we had to have a response. As a kid, I listened to my grandparents and great aunts and uncles talk about the Spanish flu pandemic of 1918 and 1919, how it literally brought life in Roger Mills County, Oklahoma to a stop for a month, 2 months, and how it killed young, healthy men and women, and how it absolutely slaughtered pregnant women and little kids. I mean, their stories were almost outlandish as a kid. Now, fast forward a century ahead. When COVID-19, the scourge rolled in, we were seeing those kind of infection rates. It was spreading rapidly. President Trump, give the man credit, stepped up and made the initial push to spend the resources to develop a vaccine. And we started down the process of maybe as many as 20 or 25 different vaccines. We wound up with 3 very effective vaccines now. He also is the person who pushed to spend the money by the federal government to build the factories in a hurry to mass produce the vaccine. He was the one who was supportive of making the vaccine free and available to everyone in the United States. So this is a Trump vaccine, first and foremost. That said, it is proven to be impressively effective. I've been fully vaccinated with Pfizer. My wife has been fully vaccinated with Moderna. I have staffers who've had the Johnson & Johnson. If you look at where we are now in Oklahoma, Scott, the good news, of course, is 58% of eligible Oklahomans are now fully vaccinated. Thank goodness. But there's some bad news too, Scott. According to the State Department of Health, for every 10 people who are hospitalized with COVID-19, every 10, 8 of them were never vaccinated. 8 of them. That could be dramatically reduced. And if you look at the federal numbers nationwide, 25% of the intensive care unit beds, that's where we provide maximum health care. You are super sick when you go to the ICUs. 25% of the ICU beds in this country are occupied by COVID-19 patients. And if that's not enough, You look at the state CDC numbers for Oklahoma, over 10,000 of our fellow citizens have died from COVID-19 in this pandemic. We're past 600,000 Americans who've died, and 500,000 of those died before we had a vaccine. So the vaccines are critically important. They've been developed in the most public sort of ways. Even President Trump has had the vaccines. I've had them, but I'm not a person who says you have to be vaccinated. People need to take those smartphones and look it up, do their research, Scott. I interact with the public in a very cautious fashion now for the last year and a half with COVID issues. But the comments I get from people that vaccines will melt your DNA, they're full of chips to track you, it'll make you docile, it'll cause you to stick to the refrigerator door when you walk by. I mean, Scott, good grief. Good grief.
You sense the frustration there? I mean, telling it like it is, and telling it like it is to which party? You know which party. He's talking to Republicans there.
Well, I'm already practically stuck to my refrigerator door, so I'm not worried about that one.
Clearly, the vaccine makes you gain weight. Clearly.
Well, I'm very grateful for.
Makes you much less likely to exercise. I know that. That's for certain.
Well, yeah, thank you for sharing that, because I do think you picked out a really, passionate statement from one of our leaders. Hats off to him for expressing it, to, like you say, an audience that needs to be treated, to a different kind of messaging maybe. And great for, Representative Lucas. Good job. And
we
getting him out there is great too.
We got to hear
when
from
you got a good clip, run it
exactly that sort of fashion. I mean, that is important, and he's absolutely right. If you're going to be the research, be honest about the research. When you're reading BS, when you're reading something that is just kind of so off of the edge that it's just ridiculous. And I mean, Dr. Sublett, I know, has been battling anti-vaxxers for 35 years, ever since Andrew Wakefield's ridiculous stuff. And so, but it's just, when you're reading something that is total hooey on both sides. And I think the fact that I'm certain he doesn't have necessarily that same sort of response to when somebody says that to him, but it's got to be one of those things where you just kind of grin and bear it, like, I can't believe you really just said that, but okay. People have to be intellectually honest. We all have to be intellectually honest. If you can read, then you can read what is total BS, and you can know that those things just aren't factual. They just aren't. And so and I'm sure I was really looking forward to the full interview, but I think when he's talking about what his grandparents saw in 1918, kind of in that area out there, what did he say, Roger Mills County? Is that what he said? Out there in western Oklahoma. I mean, it was, you're in the middle of no man's land. The dust bowls are swirling, and then people are dropping dead left and right. I promise you, if they would have had a vaccination, then they would have all lined up and got in a heartbeat. That was the way that generation was, and that was the way that things were. And it's not only saying no to the BS, but also saying yes to being part of the solution for society and trying to get past this.
And that's going to be particularly important as we go into this pediatric phase here. The parents want straight answers, and they got to be with somebody that they truly trust, that they worked with, they know that they're not going to, beat around the bush. And so hats off to Representative Lucas. I appreciate his honesty and straightforwardness.
Yeah. And I just want to say, for those folks with the conspiracy theories about the microchips and all that, let's give the conspiracists some credit. They're going to put it in a French fry before they're going to put it in a injection. Go where the money is. If they're going to be that smart, they're going after, chocolate or something. They're not going after some shot you get once a year. Or once.
Have you ever seen that meme that said with the one guy looking at the other? It's like, in retrospect, it was brilliant to put the tracers in ivermectin.
I hadn't seen that, but that's awesome.
That's a good one.
I about rolled out when I saw that.
Okay, so I have 23 seconds to say goodnight because I told Dr. Chanson we'd be done by 8 o'clock. He's got important stuff to do, being
Go my
dad.
answer.
Okay, we got to go. Thanks to our viewers. Remember, Wednesday night, Newswatch Oklahoma, and Augusta will be back for those folks looking for her. Dr. Armitage, Dr. Chanson, Dr. Sublett, and all the folks who are on tonight. Thank you very much for watching, and we'll see you next week. Good night now.
Night.
Good night.